Well, good morning, and thank you for your interest in our pharmacy technician training program here at Iowa Western Community College. My name is Sarah Kleffman, and I'm the program coordinator for pharmacy technician training. I've tried to make a short video here to maybe answer some of your questions that you might have about our training program. First of all, I'd like to try to describe a little bit about what a typical pharmacy technician would do in a practice setting. The pharmacy technician assists the pharmacist in a retail setting or in a hospital setting, but whether you're working in retail or hospital pharmacy, you're always going to be working under the supervision of a licensed pharmacist. Now, some of the things that you'll be doing may include refilling prescriptions from a doctor's office. You may need to package those prescriptions. You'll also be responsible for collecting patient information, name, address, health histories, and especially things like drug allergy information. In some pharmacies, you might do a lot of compounding of medications. In most retail settings, you'll be doing inventory of drug supplies, perhaps some ordering of drug supplies. And in all practice settings, you're going to be responsible for maintaining the confidentiality of your patient's health records. Now, pharmacy technicians need to understand and be comfortable with mathematics. That's because pharmacy technicians may have to calculate drug dosages. For example, let's just say that you have a doctor that orders an antibiotic for a patient. The doctor prescribes, say, 500 milligrams of an antibiotic twice a day for 10 days. Now, as a pharmacy technician, you know that your pharmacy carries this medication, but in a 250 milligram tab. So you would be responsible for figuring out how many tabs should the person take per dose, how many tablets do I need to fill the prescription. So that's why it's important that you have a pretty good sound basis in math. Another thing that would be ideal is if you had a background in medical terminology or just some exposure to med-term. If you haven't, though, we are going to be covering med-term during the course, and we also spend quite a bit of time just on medical abbreviations because that's how healthcare providers are going to be communicating with you. Computer skills are essential to pharmacy technicians, as they are to most healthcare professionals today. A great deal of the work that a pharmacy technician is going to be doing will be completed on a computer. Pharmacies usually have their own particular brand of software that they use for record keeping, for billing, for inventory, for reporting to insurance, third-party billing. And last but not least, pharmacy technicians need to demonstrate and have excellent communication and customer service skills. You know, many of the people that you'll be encountering in the pharmacy are people who are not going to be feeling very well. They may have seen a doctor and they've come into the pharmacy and they have a prescription for some medication. It's important that you are empathetic, that you are polite to all your customers, and behave in a professional manner, even if you're dealing with a customer who is not as polite as maybe they should be with you. Confidentiality is very important to the pharmacy technician and to everyone who works in health care. There are laws protecting a patient's personal health information. The Health Insurance Portability and Accountability Act of 1996 protects a patient's health information, which includes anything that you might say to another person, so any oral communication, any information that's in any kind of paper document, and any information that's transmitted electronically. Pharmacy technicians must be vigilant in protecting the privacy of their patients. Now, some of the personal characteristics that would be desirable if you're choosing to study to be a pharmacy technician, some of those may include just being dependable, being a person who shows up on time and does what is required. It helps too if you're somebody who pays a lot of attention to detail. You know, drugs are dangerous substances, so if they're not properly handled, small mistakes can lead to the death of a person. Need to be trustworthy. Confidentiality of patient information, as I just mentioned, is very important. And you're going to have access to habit-forming drugs and drugs with a high potential for abuse. So being trustworthy is very important. It's also important that you have good health yourself, good hygiene. You're going to be dealing with a lot of people in pretty close proximity. And you need to demonstrate a professional image at all times. Pharmacy technicians will find employment in several places. Most of the pharmacy technicians work in retail pharmacies. Others work in hospital pharmacies, in long-term care, in managed care pharmacies, and also in compounding pharmacies. The Bureau of Labor Statistics is now projecting a demand for pharmacy technicians, so the job outlook is very good. It's estimated that by 2018, so in just 5 years, the demand for pharmacy technicians will increase by 30%. So now that you know a little about the role of the pharmacy technician, let me tell you about our pharmacy technician training program here at Iowa Western. The entire class is 140 hours. You will be in class listening to lecture and learning from your instructor for the first 60 hours of the class. Now that might sound like a long time, but the class is interactive and student participation is encouraged. You'll have 20 hours of lab, so in the lab you're going to learn how to develop the knowledge and skills that you need to refill prescriptions, packaging and repackaging prescriptions, labeling, compounding, and then also learning just the basics of infection control. After you complete the classroom and the lab hours, you'll spend 45 hours then in a clinical or an externship. Now, that 45 hours is divided then between a retail setting and a hospital pharmacy, so you get to experience both. When you finish that clinical, then you'll return to Iowa Western for an additional 15 hours. And during that time, we want to do a review of everything that we've covered, and we will help prepare you to take the national certification exam. Now, the tuition for the pharmacy technician training is listed in our flyer, so check that out. That's posted on our website, or you can call us for that information too. The textbooks that are required, there's 2 of them, and they'll run you right in around $175, I believe. That's subject to change. You'll also have fees from the Iowa Board of Pharmacy. When you register to take this class, one of the first things we're going to do is to register with the Iowa Board of Pharmacy. We need to register you as a pharmacy technician trainee. And there's a fee for that, and that is $35. But we'll help you with that, and that will come after you've actually registered for the class. You'll also need to purchase uniforms, a scrub top, and a pair of scrub pants. And you can purchase these at many different stores, so the cost for those will vary too. You don't need a particular color. I would encourage you to probably just wear a solid color though. And you'll want to wait till we actually start the class there, and I can give you a little more direction with that. On this slide, I've listed the textbook that we're going to be using for our pharmacy technician training program. And the textbook is called Pharmacy Technician Practice and Procedures. The ISBN number is listed here. And there's also a lab manual that goes with the book that you'll want to purchase as well. Now there's some requirements, some course prerequisites that will need to be fulfilled prior to registering for the pharmacy technician program. You will need to demonstrate and bring in proof that you've completed high school and have a diploma, and that you have a GPA of 2.5. Now we can also accept a diploma from a GED program. Second, you're going to need to have your immunization records. That includes your immunizations such as your childhood immunizations, DTaP, MMR, varicella, polio. These are generally with your family doctor, and many times the high schools or the schools keep those records too. And a couple other things, I recommend that you do get a hepatitis B. That's a series of 3 injections. We don't require it, but just recommend that. And then a couple other things would be the drug screen and the criminal background checks. The drug screen will arrange that for you after you're registered in the pharmacy technician program. That is completed at a local hospital. We'll arrange the time and date for that, and you will pay the hospital for that. The criminal background checks, nothing for you to do there other than just to fill out the paperwork, and we will do the background checks. When you complete the pharmacy technician training program, you'll want to register for and take one of the national certification exams. The state of Iowa, the Iowa Board of Pharmacy, recognizes 2 exams, and that's the PTCB offered by the Pharmacy Technician Certification Board, and also the ICPT, the Certification of Pharmacy Technicians. So those 2 exams, like I said, are both recognized and accepted by the Iowa Board of Pharmacy for PHARM techs. We'll talk to you more about that testing process when we get closer to the end of the class. Excuse me. But the cost of those exams is right in the area of $130 to $150. To maintain your certification as a pharmacy technician, you will need to complete 20 hours of continuing education every 2 years. 1 hour of that continuing education must be in pharmacy law. Now we are planning to be putting some of this continuing education online for pharmacy technicians, so you'll want to be checking back to the Pharmacy Tech website from time to time. Well, that's all I have for you right now. We look forward to having you in our pharmacy technician training program. If you have additional questions, please email us at pharmacytechnician@iwcc.edu. And thank you for your time.